recently started doing some of these lives because we've gotten a lot of comments on our YouTube channel about groin pain, lower abdominal, and so on. A lot of you runners out there reached out with questions and comments, and unfortunately, it's not really easy to respond on YouTube. It's not like YouTube has like private messaging, and it doesn't always alert people when we actually respond back. So I'm going to attempt to do some videos in live format here, at least over the next couple weeks, ideally this time in the morning, and mainly to see if maybe this is a good way to get the information out to you guys in a timely fashion versus just it getting lost in the YouTube world and not really you're not really seeing what the responses were. So I'm going to highlight every time I do this one of the comments that we have, and so if you have not commented on our videos, do so, and you could be picked for some of these questions that I'm going to answer here. But I'm going to talk about lower abdominal pain today with runners, and we had a question, and I apologize, I'm driving, I'm not going to be able to read it precisely, but it was something to the effect of they're having lower abdominal pain while they're running, and they have had a bunch of images done and nothing's really wrong, and they're wondering what to do about it, and their doctor said they don't really know what's going on. And so I can tell you, at least from a movement perspective, that many of the people that we see, apologize, there's going to be a lot of bumping, okay? So just put the phone down and listen to the audio. A lot of people that we see here, even in virtually, we find that many of them have restrictions of movement in areas that are around the core area. And the reason I picked one of the thumbnail for this video today was a referral of a trigger point from the QL muscle, which you'll see if you go back in the thumbnail for this video, that it actually refers and wraps around to the front. It goes around to the groin area, it goes to lower abdominal area. Some people feel problems into their back, most of them actually do. Some of the X's reference different locations of trigger points in the actual research that they did. And so everybody's going to have a little bit of different variant on this. But so what I've experienced, most people with lower abdominal strains, especially if they don't really have any big bumps and lumps and stuff like that, and it's movement based, a lot of them are actually referred from not just the QL muscle, but there's some sloppiness of the lower back. By the way, not medical information. You should make sure to get yourself checked out because there's lots of different things that can create lower abdominal pain. I think we all know that. So be a responsible adult, get yourself checked out. But what we find here from a movement perspective or an MSK perspective is that the QL muscle potentially may be working too hard to stabilize the lumbar spine region of the core area because it's having to move too much. It's not stiff enough, at least when you're doing sports like running. We generally think of the core area as an area that can produce movement, but generally it's a stable region. The areas around it, such as the thoracic spine or the mid-back, as well as the hip, are areas of motion. If you guys are interested in more education about this, there's something called the regional interdependence model. The regional interdependence model basically goes over between how there's mobility and stability regions in the body that prioritize those as a job, but they can do the other parts too. In the core is a lot of times the stable aspect. These areas tend to alternate. And so when the QL has to work too hard, there may be trigger points that reside within it and create the referral to that area. Now, how does this relate to running? Well, with running, there's a lot of arm twisting, right? There's a lot of hip movement. And so if those areas are too stiff, it's going to push the workload or the movement demands upon the lumbar spine. We call running an extension-based activity, which a lot of people who end up having problems with running also have problems with other extension-based activities. Split squats, where the leg that the abdominal pain is on is in the back, and they're being very heavy on that leg, like a 50-50 split type of scenario. Also, they may have problems with throwing, pull-ups. They're all the extension or archy-based activities. Not to say you can't do them, but the corruption with the movement strategy is in an extension-based activity. The more you remove the amount of extension-based activities, such as sprinting is provocative, but jogging's not, it generally the better it gets. But depends what you want to do with your life. Do you want to keep sprinting, or do you want to only jog? So when we make suggestions to people, a lot of times in our telehealth, it's based upon, number one, is there a restriction of your hip or your thoracic spine that we can see or test for? And a lot of times just a good trained eye can a lot of times point these things out. A lot of times people have big past histories of problems, like, yeah, my hip has been a problem for decades, and like it's like an area that we can kind of focal in on, and it has a longer history, so it usually is a part of it. And then we usually keep them active as much as possible. The fastest way to feel like you're old is to not be able to do things that you want to do. Kind of the feeling of helplessness, or the feeling of like your body is not physically able. I always say that, like, one of the things that people lose, like if you take like a broad stroke of like observing like older people, or people who are not really they are able to do a lot of physically demanding things. A lot of times they do very small movements, and they also don't spend a lot of time on the ground. They also don't jump a lot. So there's certain attributes that are usually I don't say lost, but they don't have them at that moment. And if they regain them back, a lot of times they do feel a lot better. Let's see what some of these comments are. Let's see. Trigger points near the hip bone. Yeah, there's some trigger points down there. I did some shorts recently about the adductor trigger points. And actually, if you guys look on, like, if you look on Google, there's a book called, it's a red book. It was by a few people named Travell and Simmons. And all of those pictures that you see online, which are just like black and white drawings with a bunch of red dots and spots and stuff like that, it's from those books. And so those are great reference points, and what my understanding what those were, and I do have the book. It's been a long time since I've read it, but I got it back in my house, and there's a ton of highlights and underlines. I spent a lot of time in that book, and it made me realize that a lot of times people's feelings or their complaints are not exactly where the problem is. And those books cover, basically they would challenge a trigger point, and then they would ask, what do you feel? And all those little dots represent how people were responding. And the more dots, the more red it is, the more common the complaint. And I remember I saw one recently, which I'll have to do a short on pretty soon. It was somewhere in the foot, actually. I want to say it was like the muscle that goes to the big toe, only in the small part of the foot. So I think it was like the flexor hallucis brevis. It actually created, I think, jaw pain or ear pain or something like that. It was very interesting. But I've seen a lot of people with ones around the hips complain of stuff to the knees. A lot of times they complain of the lower abdominal, sometimes the back of the SI joint. And this is kind of the trouble with only looking at the area of pain and not looking at the whole individual, is you can give people like diagnosis for each one of those locations, right? But really, one of the best strength coaches around his name is Dan John. If you guys don't know about Dan John, he is a wealth of knowledge, very educated guy, and he has a podcast and a YouTube channel and so on. And he makes things so simple, and he makes it that way for a reason. He can definitely make things complicated, but one of his saying is, I think it's something to the degree of like, the body's one unit, the body's one thing. Only in human dissection did we decide, you know what, we're going to separate these areas. And like, granted, there's areas that like there's slivers of things elsewhere, but I remember years ago they started doing some more dissection specific to fascia, and they found out that more things were connected than you think. Like, you can't just rehab a low back in the absence of looking at someone's hip. You can't just rehab an adductor muscle in the absence of looking at someone's core stability and their single leg stance. Like, you can't do any of that stuff. And a lot of people who are, like, if you're an athletic individual, like when we started this conversation talking about runners, like, if you sit all day and your hip is in a flexed position and you're only exposing it to extension for like 30 minutes a day, what do you expect? You know, like they're like we weren't meant to sit around all day and to expect top performance out of your body when you don't really treat it like a professional athlete. Is very it's that those aren't realistic expectations, and I'm not an exception to that rule. I do my own mobility and strength training during the week, and I do some cardiovascular fitness, and I don't love it all, and I do it because I want to play my sport well and not get hurt. I'm in my 40s and I still sprint now, and I've had some injuries, but also they coincide with times where I wasn't really responsible with my sedentary time. So, all right, guys, that was all great questions. I apologize I can't respond to all of them. I just got to the office here, but if you guys ever want some help, just reach out to us, 714-502-4243. We do telehealth sessions. Also, we have literally thousands and thousands of videos on YouTube at this point. If you go to our channel and subscribe, there's a little search bar, I think, at the top there. Just search whatever you want. I do my best to organize them on YouTube, but YouTube is not great at allowing creators to create a bunch of different categories for people. We do our very best to do part one, part two, but we've done so many videos where we do like 4-part series on things. Don just did one on 4-part sports hernias, and like I can see the view count. Like the top one has like 10,000 views. The second one, second week, which you'd imagine people watching week one, but also week two, and then follow along, it has like half, and then it's half all the way down the line. So always search for what you want on our channel. All of the content is it's nothing that we're not hiding anything when we do it on there, but all the exercises and stretches we do, at least from a personal perspective, 'cause everybody's a little bit different with their coaching. We do it based upon the individual. So I wouldn't suggest a hip stretch to someone who doesn't have a hip range of motion restriction. Why? Like, what's the point? You could, but it's just kind of a waste of time for the person, or maybe we call it preventative. If someone has good core stability, let's not look at the QL as a part of this problem. Let's look at something else. Let's look at the hip. So I hope it was helpful to you guys. Remember, I'm going to come back online here periodically in the morning hours like this and answer questions that you have from our comments. But go to all of our videos and do some comments. I do read them on a daily basis, and I'll pick the best ones that will give everyone the most information. See you guys soon.